We are getting word at this hour that the second case of MERS, that deadly virus MERS, has been imported into the United States. We want to bring in our senior medical correspondent, Elizabeth Cohen. She joins us from Atlanta. I think a lot of people are really familiar with this. Give us an idea of what it is and why it's so deadly. You know, it's a 30% mortality rate, Michaela, so that is really quite high. So it's called MERS, and it's a respiratory syndrome. And you can see here that it was first reported just in 2012, and it can start innocently enough, but it can get very bad very quickly, and it's spread mostly through close contact, you know, family members, people you're living with. And so what the CDC is going to report this afternoon is that a second case of MERS has now been found in the United States. There was one in Indiana recently. This new one is in Florida. Now again, just like the first case, this is a healthcare worker who was working in Saudi Arabia and flew back to the United States. Now, all we know about this person is that this person's in Florida and took several flights to get from Saudi Arabia to Florida. And so now they need to go and contact the people who were on that flight to make sure that they get checked out as well.
So hey YouTube, welcome to another video from Skinny Medic. Wanted to give you some information on a new disease that is coming to the United States. It's called MERS, M-E-R-S. We just had our first case here in the United States, and it's a quite deadly disease. So I've done some research. I've got a lot of information to share with you, so basically look down some paper. I've got 3 pages actually printed out for you on some information, which I'll provide all of the links below on the information. So just wanted to give it to you. Right now this is not, the threat level of course is low. It's not a pandemic and like that, but this is a deadly disease, and I want to give you some information on it. This first patient here in the United States traveled from Saudi Arabia to Chicago, and then was ultimately seen and treated in Indiana. And so
nadagdagan pa ng 13 ang naitalang kaso ng Middle East Respiratory Syndrome Coronavirus o MERS-CoV sa Saudi Arabia. Dito naman sa Pilipinas, mahigpit pa rin ang pagbabantay ng immigration sa mga pasaherong pauwi ng bansa na posibleng may sintomas ng nakamamatay na sakit. Base sa tala ng Saudi Ministry of Health o MOH, nasa 244 na ang tinamaan ng MERS-CoV sa Saudi. 75 sa kanila ay namatay na. Ang mga Pinoy doon, todo ang ingat para di mahawaan ng sakit. Nag-iingat kami.
You're with News 5 tonight. The Ministry of Health has reminded doctors to be on the alert for possible cases of MERS. Doctors are advised to refer patients to hospital if they have clinical signs and symptoms which are suggestive of pneumonia and if they have traveled to the Middle East.
We will ask the patients whether they have a travel history to affected areas and whether they have high fever, and they will be separated from those patients who do not have high fever, and the doctors will be informed immediately so that we will be vigilant to know whether it is MERS. And if we think that it is MERS, then we will call the ambulance 995, who will send them to Tan Tock Seng if they are adults and to KK if they are children.